and it manifests itself differently in different women. That's one part of it. However, there is a biopsychosocial sort of way to look at PCOS and the impact of it. And the biological part is, of course, there is estrogen and progesterone levels in the body fluctuate, etc., etc. How it impacts our serotonin levels, how it impacts our cortisol levels, which are our mood hormones, our stress hormones, and how it disables us to cope with our emotions well. That's one part of it. You asked a question right now that why is there not enough conversation around it? I think one of the reasons and the big social stigma that we have attached to this whole problem is that women reproduction is exactly what it is. It's reproduction. For a lot of us, reaching a menstrual age or reaching an age of puberty is equal to ability to have children. The conversation is not around how it's impacting us. The conversation is around, okay, there is a girl, she has developed PCOD, which means that her fertility has, it's impacted her fertility, probably. And what does that mean? That means that she may not be able to conceive a child in the patriarchal conditions that we are used to talking about. So the focus shifts there. The focus shifts on how it is actually a reproductive problem and not a human problem or a female problem, which is why there is not enough conversation around it. We have never really gone below the level of looking at it from a holistic perspective and saying that it impacts socially, it impacts you, because it does. We know for a fact that it impacts your sex drive, so it will impact your social relationships, especially romantic relationships. It also has a psychological impact, and there's no conversation around it because we are still on the surface talking about how it impacts fertility, and that's the job. We have to produce kids. There is also now, thankfully, there is conversation around facial hair, hair loss, acne, and basically things that are visible because they lead to very obvious body dissatisfaction, body dysmorphia, where you're dissatisfied with the way you look, and especially in young growing girls, where looks become a very important manifestation of one's personality. They're an extension of one's personality, and you want to look good. Right. So I think one of the reasons why there's not enough talk is because of the social stigma that surrounds women menstrual health on the whole. Second is the lack of awareness that we have on mental health in general. Right. So I think both of those things combined, we don't really pay attention.
Another factor that I feel contributes to the lack of awareness is that there's not much empirical research also in the field, especially in India. So when I was looking up literature on this, I found out that there's very little scientific literature on the mental health impact of PCOS on women. And when we don't have literature, there's obviously lack of awareness generally also. So there's very little research, and it intrigues me why people are not researching about it, because it's a major concern, especially in India. And another reason I feel is that when we talk about mood swings, Rashi, you just mentioned that they're sometimes very casually mentioned, like you're being cranky, right? So we always associate mood swings in a very casual and a very joking way. And sometimes hormonal fluctuations that PCOS causes can lead to very, very extreme and sudden mood swings. And that can also be a symptom of a more clinical concern, even depression sometimes. And since we are so used to ignoring mood swings, we think that it's just a part of life. And sometimes it just gets ignored very casually.
One link that is which I feel is majorly missing is the link between physical and mental health. There is no link between physical and mental health. We have the evidences that we have even now are very anecdotal, right? There was a study done at Columbia University at their School of Nursing, where it was reported that PCOS was one of the strongest predictor of mental health issues in women. However, that is just anecdotal. There was not enough and more research done on it. Biologically, we have little bit information here and little bit information there that how our hormones impact the release of serotonin, of cortisol, etc., etc. But there is not enough and more evidence to talk about it with with impact and say that okay, this is what it can lead to, right? And because it's so complex, because both mental health and menstrual health manifests itself so differently in people and in women, that it is, and it's said, and very jokingly, and we've heard it a lot in our field, that औरतों को तो रोने की आदत होती है. They crib a lot, they cry a lot, they
They
throw
turn
too many
hysterical
tantrums.
even. I think one of the other reasons why PCOS is talked about so little is because it essentially reflects the failing of a woman from her fundamental duty, which is to
Which is
either
producing. Yeah.
to be attractive or to reproduce.
Yeah.
So and PCOS interferes with both.
Yeah.